So what role can acupuncture play with all of this? So the first thing is, that acupuncture can provide pain relief. So people don't need to take as many opioids, or maybe they don't need them at all. Acupuncture can treat side effects that are most commonly associated with opioids, including nausea, vomiting, and constipation. And then the role of acupuncture for for addiction treatment, including withdrawal symptoms and cravings, and also the quality of life issues that do affect the perception of pain. Insomnia, depression, all of these can affect our experiences of pain. So acupuncture can help with that as well. The next couple slides are from the World Health Organization did a pretty exhaustive review of acupuncture research. It's one of the lists that I like the most in terms of the benefits of acupuncture. And what I've done here is in bold listed the conditions that are either pain related or related to side effects of opioids. Dysmenorrhea is facial pain, headaches, knee pain, low back pain, nausea and vomiting. We've talked about as a side effect. Neck pain, dental pain, periarthritis of the shoulder, post-operative pain, sciatica, sprains, stroke, tennis elbow. These are all conditions that it's very common for physicians to prescribe opioids. Again, these are diseases, symptoms, or conditions which acupuncture has been proved through controlled trials. So these are the best types of studies have shown that acupuncture is effective for these treatments. The next slide is diseases, symptoms, conditions where there's a therapeutic effect of acupuncture has been shown, but which further proof is needed. So in a lot of these, there's been studies, but not necessarily great studies, and so we need a little bit more research for these. But there is certainly a therapeutic effect. So pain-related, we have abdominal pain, earaches, eye pain, facial spasm, fibromyalgia, gout, arthritis. Labor pain, postherpetic neuralgia. Here's opium, cocaine, and heroin dependence. Osteoarthritis, pain due to a number of different exams, PCOS, radicular pain, spine pain, stiff necks, TMJ. Again, very commonly prescribed for pain medication. So we know that acupuncture has been practiced for a very long time, and what it is insertion of very small needles on the body to modify or prevent pain and normalize physiological function. So the research is really divided into clinical research and basic science research. Clinical research, we've just done a very quick run through. And so now we're going to look around in the basic science research, which really focuses on mechanism of action. And so we know, I'll show you a couple studies that show that it's mediated by endogenous opioids, so our body's natural painkillers. And there's quite a bit of research on electro-acupuncture. So the picture here shows there's 4 needles that go on kind of the corners of the knee, and then there's clips that are attaching. There's 2 leads on each side, and traditionally, after acupuncture needles are placed, we manipulate the needles by hand, and so it's kind of this like twirling action, right? And so what that does is it stimulates the process, the acupuncture. We call the feeling de qi, which is like the stimulation of the acupuncture points. And that's how we know it's working. Electroacupuncture is a way of doing this kind of in a controlled way, So we're putting, it's the same thing as a TENS unit. So sometimes in physical therapy, they'll put the pads down on the skin and there'll be like a buzzing sensation. These are very common, in physical therapy. Well, we'll actually hook those up to the needles themselves. And so what that feels like is, you have the needles that are placed and then you'll just feel this like buzzing sensation. And it's a little strange the first time you have it, but your body gets accustomed to it, and usually people are asleep by the 5 minutes into it. It's very relaxing. And so there's been quite a bit of research about this electroacupuncture. I do want to say that we're focusing entirely on the biomedical model today. So there is an entire thought process about with the diagnosis and choosing of points for acupuncture. So this on the left is the 5 elements chart, or the 5 phases. And there's a pretty complex way of thinking about the body in order to come up with the points. And so we're not talking about that at all. The assumption is, at this point, you've talked with an acupuncturist, we've had an assessment, there's been a diagnosis, and now we've chosen the points, and the treatment begins here. And so the mechanism of action part of that is, okay, now what happens after the needles have been inserted. So we're talking purely biomedical here. So in 1999, there's an interesting study that was done, and this was a follow-up study to something that had been done about a decade prior, which was a study on morphine withdrawal in rats. So what the researchers did was they created dependence of morphine of rats through morphine injections for 8 days. And then after the very last injection, they wait 24 hours and they give the rats electroacupuncture. And they do a test for the pain induced, the pain response. And the initial study, they had found that there was anesthesia that the acupuncture presented for the rats. Now, what this study does is they give the rats then naloxone, which blocks the effect of opioids, right? So they found that this same study, the rats no longer had that pain relief. So we know from this study that the 100 hertz, in this case is kind of a higher frequency used for electroacupuncture, increased the release of dynorphins in the spinal cord via a very specific receptor, the kappa opioid receptor. So it was from this study that we know that the acupuncture mediator, one of them at least, is endorphins, is your body's natural painkillers. This is from a 2014 study. So this is what's gone on between 1999 and 2014. That from these rat models, there's been a number of different very specific pain models that have been developed for acupuncture, and includes inflammatory pain, visceral pain, neuropathic pain, and also cancer-related pain. And I think it's kind of interesting, the figure on the right shows the corresponding acupuncture points, the most popular points for humans, where those are on rats. So, which is what they stimulate for those types of points. This is a kind of a complex schematic that does kind of a nice job of overviewing the different, in addition to the opioids, other modulators. So at the peripheral site, at the spinal cord, and also at the supraspinal structures, so in the brain. And in each level of these, there are some endorphins that are being mediated, but as you can see, there's other mediators also that are stimulated by the acupuncture. So kind of a little bit of a conclusion of the mechanism of action. The electroacupuncture stimulates the release of endorphins. There's both high and low frequency, which actually works differently on different opioid receptors. And this right here, I don't know if you can see, that shows the difference between 2 hertz and 100 hertz for the different receptors. The way that translates clinically is that we use alternating frequencies in electroacupuncture. So you'll have 2 hertz, which is more of a tapping sensation, and then 100 hertz, which is more of like a buzzing. And so we'll have set up people for about 20 minutes that it alternates between the two. And so you're stimulating both short-term and long-term or long-acting endorphins. So we take advantage of that. And as I just said, it takes 20 minutes to have the analgesic effect for electroacupuncture. So we usually set the timer for 20 minutes. There are, other than the opioids, there's likely, these are the other mechanism of actions, DNIC or diffuse noxious inhibitory controls. If you've ever had acupuncture and you have like an immediate response, there's some different types of acupuncture where you'll have pain relief that's immediate. This is the mechanism, whereas the opioids take about 20 minutes to release. This is much quicker. There's also the myofascial pain models for trigger point, or what we call Osher point releases. And then there's an entire body of knowledge about the endocrine effects of acupuncture through the HPA axis. So this is kind of a neat study that was done. It's a meta-analysis of a total of 122 studies, all on sciatica. And what they did was they found 21 different interventions for sciatica. And they were able to compare them through this study. And out of all of these, acupuncture was second in global effect. The only one that beat acupuncture was a biologic treatment that is in it's not available and won't be for a really long time. But acupuncture was second in global effect, superior to both opioid and non-opioid medications. Acupuncture safety, we've talked a lot about the safety of opioids. Well, we have to also talk about acupuncture safety. It is considered quite safe with very few side effects. This is best demonstrated in an observational study that was done with 10 German health insurance companies. They gathered about 500,000 patients who had acupuncture for headache, low back pain, and osteoarthritis. And from this study, they found that only 8% of people reported a minor event, which included needling pain, either bruising or bleeding, and then 0.0003%, so 13 patients out of about 500,000 reported severe events, which included pneumothorax, puncturing of the lung, either hyper or hypotensive crisis, a skin reaction, asthma attack, or aggravation of suicidal thoughts. So this is, as far as side effects, this is very, very good. Very, very few side effects with acupuncture.